everyone, and welcome to the Lake Superior Quality Innovation Network, or LSQIN, National Nursing Home Quality Care Collaborative Kickoff Webinar. The LSQIN represents Minnesota, Michigan, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. All lines will be muted during this webinar. However, after the presentation, we will have a time for questions and answers, so please make a note of any questions that may come up as you listen. I'm Christy Wergeen, and I'll start us off this afternoon. I'm a program manager at Stratus Health, and I will be one of the contacts for the participating nursing homes in Minnesota. Later, you will have an opportunity to hear from representatives from Wisconsin and Michigan. So welcome, everyone, to the National Nursing Home Quality Care Collaborative. We're really excited about this. And so far, nearly 500 nursing homes from our 3 states have joined. We hope that your nursing home teams will feel empowered that by participating in this collaborative, you're going to make positive and lasting changes to improve the quality of life and the quality of care for those living and working in nursing homes in Michigan, Minnesota, and Wisconsin. So you all are really leading this charge. So congratulations. This afternoon, we will be defining the goals of the National Nursing Home Quality Care Collaborative and share what will be expected from those participating. We plan on providing many learning and collaborative opportunities, and some of those have already been scheduled, so we're going to let you know what's coming up. The learning and collaborative opportunities will be focused on how to make changes in the way you do your work to be more efficient and improve your outcomes and support an environment of continuous quality improvement. That's a lot. So to ensure that those living in your homes always receive the highest quality of care, it's really important that you develop, refine, and monitor systems to make sure that they support your desired outcomes. So for example, if your home has a system in place for staff to easily communicate changes in resident condition in a timely fashion, you're more likely to provide the needed care for the resident and avoid an unnecessary hospital admission. That's just an example of a systems change that really makes a difference. You will note that this work will be done in a collaborative framework. We're using that word collaborative a lot, so we want to just spend a few minutes talking about what a collaborative is. A collaborative gives teams from a variety of organizations, and as I said before, we have almost 500 that have joined so far. It gives you all the opportunity to work with each other to rapidly test and implement changes and share learning that leads to lasting improvement. So in addition to the traditional learning opportunities like this one today, such as webinars, we're going to also be providing opportunities for you to share with each other via conference calls, sharing of success stories, via newsletters, webinars, and Donna's Diary, which is a blog-like sharing site that we'll talk about later on in the collaborative. So there'll be plenty of opportunities for you to learn from each other, and that's really an important part of a collaborative. The image on this slide is a visual from the Institute for Healthcare Improvement, or IHI, and it's called the Breakthrough Series Model for Improvement. The National Nursing Home Quality Care Collaborative structure is based on this model, and the Institute for Healthcare Improvement developed it to help healthcare organizations make breakthrough improvements in quality while reducing costs. So the boxes that you see on this slide represent the learning sessions. So you can see that there are 3 boxes that represent 3 learning sessions, and then participants are asked to test changes using PDSA or Plan, Do, Study, Act cycles to test and refine changes in between the learning sessions. So we will be giving you more information on what that exactly means, PDSA cycles, for those that you aren't aware of it later on in the collaborative. So you heard me mention learning sessions. So I just want to talk a little bit about those because they are the really important thing that's part of this collaborative. And we realize that you're all in different places in your quality improvement journey, so you're going to be encouraged to pick and choose from a variety of learning opportunities that we're going to present to you. However, we're going to really ask that you make a special effort to participate in the learning sessions, as these are going to provide the foundation that will help you refine the way you approach quality improvement within your nursing homes. This is kind of the foundational pieces that you're going to learn in the learning session. Remembering that the goal of this collaborative is to help you change the way you do your work. The learning sessions are going to provide that foundation on how to make those changes. I just want to spend just a minute talking about our first learning session, since it's coming up quickly, so you kind of get an idea of how at least we're going to do this one. The learning sessions will be virtual learning sessions, so they will not be in person. So I know in the past, many of you are used to working with QIOs perhaps and going to events in your states, maybe half-day or whole-day events. But we're working together as it's 3 states. It's a large area. We're wanting to respect everyone's time as well as your resources. And we're just trying to do something a little bit different this time, and that our learning sessions are going to be virtual. So what that means is we're going to be putting together a package of like 4 short recorded webinars. They'll probably be 15 minutes to a half an hour long. We'll put those together and then ask your team to come together and listen to those 4 short recorded webinars within probably about a 3-week period. And after you listen to the webinar, and hopefully you'll be doing that with a team, and again, this will be reinforcing, one of the important QAPI principles, to work together as an interdisciplinary team, to watch the webinar and then do a short activity after the webinar, so it's action-oriented. So we're just not talking at you. We're going to be just giving you some information in hopefully a quick, concise way, and then you can take that information and do some action, so that by the end of all those 4 recorded webinars, you'll actually come out with something that you've done and that you can follow up with. So the first one of these will be in May, and so in the beginning of May, we'll be sending you the information about it, the links to the recorded webinar, and some more instruction on how that will go, and then we'll give you till the end of May to really finish that up. So I just wanted to mention that so you know what's coming up, and when you hear learning sessions, I just want to make sure it's clear in everybody's mind that we're not at this point asking anyone to go anywhere. Okay, so what are we going to focus on? In the National Nursing Home Quality Care Collaborative, we're going to really focus on using QAPI principles to help eliminate healthcare-acquired conditions and improve resident satisfaction, which is quite a lofty goal. So this slide lists some of the system-wide focus areas that have an impact on quality that we're going to be talking about during this collaborative, and you can see them on that slide. If your team feels like you need to improve in any of these areas, be sure to watch for learning opportunities that address these focus areas. So, for example, staff stability, we know that's something that you all struggle with. It's very difficult to find enough staff that are qualified. But if you really don't have a consistent staff or enough staff, you spend a lot of your time just trying to fill holes or just trying to take care of basic care. And it's really hard to find the time to really do quality improvement when you're just struggling with day-to-day things. Okay, so those are more system-wide things. So we're also going to be focusing on some clinical focus areas that have an impact on quality, and you can see these on the slide too. These are all areas that are really receiving a great deal of attention right now. You hear a lot about unnecessary antipsychotic medications and reducing hospitalizations and that kind of thing. So you can be sure that we're going to be talking quite a bit about that during the collaborative. So perhaps you're working on some of these things, or you're considering more focused work on one more of these areas in the future. Well, you've come to the right place, because we're going to be offering quite a bit on these topics. And we'll also look forward to hearing about how your nursing home teams have made improvement in these areas, so we can share what you've learned with others. Measurement is a key component of quality assurance performance improvement, and it's important for us, too, as a quality innovation network. So we're going to be using the Composite Score to help determine how well participating nursing homes have developed systems that support quality quality measures. So this is a measure for those of you that have never heard of it. The Composite Score is a measure that was created by CMS, the Centers for Medicare and Medicaid, for the purpose of measuring progress in the National Nursing Home Quality Care Collaborative. So this is what CMS is looking for, or looking at to measure this success. And it's offered as another way to look at quality from a systems perspective. And it's in no way intended to replace the existing CMS measures or scores, such as the 5-star rating system, but it's just another measure. The purpose of the composite score is to remove the desire to focus on one measure at a time, which, we're all tempted to do, just kind of pick one that we're doing really poorly on and spend a lot of time on that, but rather focus on the systems that support the measures. So again, as I mentioned with recruiting and retaining quality staff, that would be a system that if you worked really carefully on, it would hopefully make a difference, and that it would affect more than one of your quality measures. Some other examples of systems that support these measures include teamwork and communication, leadership, consistent assignments, being a continuous learning organization, and we'll learn more about these in a bit. The composite score is calculated using the 13 quality measures that are publicly reported on Nursing Home Compare, and it reflects the cumulative effect of systems improvement. So, on this slide, you'll see the 13 measures that determine the composite score. And let me just tell you a little bit about how they figure it out. The composite score is calculated by summing the 13 measure numerators, and so then they obtain the composite numerator, and then they add up all the 13 measure denominators, and they divide that and then multiply by 100, and they come up with the composite score that way. This methodology is based on what's called the opportunity model. It's because the denominator represents the number of opportunities to provide or reflect high-quality care, and the numerator represents the number of times an opportunity is missed. So since the numerator, and I know this takes some thought, but since the numerator represents the number of times an opportunity was missed, the lower the composite score, the better, since the higher the numerator will create a higher composite score. So if you have more missed opportunities, it's going to raise your composite score. So what that means in a nutshell is that the lower, the better. So when you're looking at the composite score, know that you want it to be lower. Now, this is not a public measure, so currently composite score data are shared with all the quality innovation networks, like the LSQIN, and what we're going to do, so we get that data every quarter from CMS, and what we will do then is we will share these data with all nursing homes participating in the National Nursing Home Quality Care Collaborative. So let me show you what that's going to look like. Nursing homes that are participating in the collaborative will receive by mail reports that look similar to this every quarter. So you can see on the left-hand side of the slide the bigger trend report. That is your composite score. That trends your composite score, and it compares your home to the state, to the region, to the national, and you can see how you're doing. You're also going to see trend graphs for each of the 13 quality measures that make up the score. So in addition to the composite score, we're going to send you on the right-hand side, these are just a little snapshots of a couple of those 13 quality measures, anti-psych and pain. We'll do the same thing with that, so you'll be able to see how you're trending in all of the quality measures that make up the composite score. So I'm going to again say that when you get this data, and when you're reviewing your composite scores, keep in mind that the goal for the National Nursing Home Quality Care Collaborative is to achieve the lowest score you can, and the target is a score of 6 or better, so 6 or lower. So this was established as a goal because prior to the launch of the National Nursing Home Quality Care Collaborative, 10% of the nation's nursing homes were already performing at this level or better, so it's kind of a stretch goal. They're saying, you kind of try and reach that 6 or better, you're knowing, you're really special because the homes that were doing really well with their quality measures were in that 6 or better. However, do keep in mind that there are likely multiple reasons why individual homes may have a high or low composite score, which you're probably all thinking right now. And so this doesn't necessarily reflect the quality of your home. So we want to make it clear that this is one measure that we're looking at to kind of try to help figure out how systems are going on in your home. But we certainly realize that this is certainly not the only measure, and it doesn't necessarily reflect the quality of your home. You can have a very low quality score, which is good, and then have a really bad survey or some complaints or something be happening in your home. So there's a lot of ways to look at quality in a nursing home. As you change the way you do your quality improvement work by refining systems and incorporating QAPI principles into your culture, and we'll be talking a lot about this during the collaborative, you should see improvements in all of your quality measures, or at least more than one or two. So these system improvements should then be reflected as a decrease in your composite score. So if you're improving, across the board, this should start bringing your composite score down. Okay, so I'm now going to turn it over to Liz, who will share with you strategies that will lead to system improvement. So I'm just going to give Liz the slides.
All right, thank you, Christy. So as Christy just said, I'm Liz Dominguez, and I'm a quality consultant at MetaStar in Wisconsin. So how do you create a culture within your nursing homes that supports continuous quality improvement? In this collaborative, we will be focusing on strategies that will help your nursing home develop a quality culture. These strategies were identified after studying high-performing nursing homes that consistently had high-quality measures, high resident satisfaction, and stable and engaged staff. These 7 strategies provide the foundation for creating a quality culture and also include action items that your nursing home can use. The first strategy of lead with a sense of purpose further means that the actions of leaders multiplied by the actions of many shape a culture and organization. It can mean be the leader you would want to follow, let your nursing home's visions drive your actions, set clear expectations for staff that are centered around mission and values, and also encourage and welcome ideas and issues from staff, residents, and family. Another action item is taking time during your day to be on the unit or neighborhood, talking with staff and residents and family members, and also being responsive to issues that arise, as this will help in building trust with others. The second strategy is recruit and retain quality staff. One way you can do this is by setting high expectations for all staff, that they should feel that their primary purpose is to provide quality care to residents. Hire staff who meet your mission and vision. Consider hiring for character and interpersonal skills, remembering that fit can be as equally important as skills, since often clinical skills can be strengthened or taught. Welcome new staff and give your best staff a reason to stay. For new staff, one idea is to assign a mentor or a buddy to them, and when assigning a mentor, ensure it is someone who represents your mission and values. And you can also enhance the mentor's experience by providing them with the training they need to know how to teach to the new employee's learning style. Also, provide your mentors with support if they have issues or needs. Another idea is during orientation, you could consider having new staff shadow other disciplines to see how their roles interact with each other. For your experienced staff, a benefit they may enjoy is flexible scheduling so that they can better balance their work and home needs. The last point is foster a sense of family and community. A fun idea you could try for this would be to bring the staff and residents together by creating a game where they will get to know each other better, such as having baby pictures of the residents and staff and having them guess who is who. The third strategy is connect with residents in a celebration of their lives. This can be achieved by creating an environment where the residents come first. Remember that the facility is their home. One example of creating a home-like environment is having a welcome gathering to introduce new residents. Even those who will be there short-term can benefit from better knowing the staff and the other residents. An example of fostering relationships with family is providing them with activity ideas. and this can be especially beneficial for families of residents with dementia. You could suggest bringing in a pet, sharing photos, or sharing stories with that resident. Another way to implement this strategy is to know residents as individuals. An action item could be to have a birthday list of the residents so their special day can be celebrated, or have a resident of the month. Lastly, but certainly not least, other items include making residents' needs a top priority and seeking resident and family input in improvement efforts. The fourth strategy is nourish teamwork and communication. Teams that function well together, respect each other, and work toward common goals. Leaders and all staff should expect and support effective communication. Leaders should also expect that everyone should be a team player, and this also ties in with the last bullet on the slide of expecting all staff would assist a resident who is requesting help. Communication and teamwork can also be improved by implementing huddles between shifts, and other action items include using interdisciplinary teams for problem solving, and consider including all shifts when problem solving, since the different shifts often provide different perspectives and ideas. The fifth strategy is be a continuous learning organization. Know when and how to change, and use your data to drive performance. Make systems thinking the norm, and Christy had some previous slides talking about the different systems in a nursing home. You can track progress and implement change if needed. When reviewing your progress made or any performance data, you be open and transparent by sharing this with staff, your board, and residents and family. Be proactive and discuss processes and systems that aren't working well or have the potential to go wrong, and try to fix these things before an adverse event happens. And involve all staff in goal setting, RCAs, and PDSA cycles. Also remember to focus on the human side of change, because change can be difficult. Let staff know why the change is needed and what they will have to do specifically to make that change. Staff also needs to be supported if change is being made by providing them with resources and tools. And check in with staff on a regular basis to see how things are going and address and remove any barriers or concerns they may have. The sixth strategy is provide exceptional, compassionate clinical care that treats the whole person, because engaged and competent staff can better anticipate and better manage the healthcare needs of residents. Ways to do this include implementing consistent assignment. Before implementing consistent assignment, train and educate staff on benefits so they have more buy-in. Also involve staff, families, and residents when making assignments, and then make adjustments as necessary. Exceptional care is also provided when change in resident condition is communicated between shifts and when evidence-based policies and procedures are utilized. The seventh strategy is construct solid business practices that support your purpose, meaning a well-run nursing home excels as a business. It feels like home. Ideas include using satisfaction surveys with referrals, besides sharing the positive feedback with your prospective residents and families. Also share the issues or concerns on previous surveys and what the facility did to follow up on those. You can create an event to draw community and financial support, and another action item would be to ask for resident and family feedback on the physical environment and explore opportunities for improvement. So these strategies that I have just reviewed, as well as the action items, are intended to stimulate creative and critical thinking. The strategies can be found in a change package that was created by CMS's study of high-performing nursing homes. The efforts described come from conversations and observations of both leadership and direct care staff. So here's a link to download the change package. When looking at it further, you will also find that included in here are 3 bundles focused on what nursing homes should do, what the previous nursing homes did in the previous collaborative, what they did to successfully reduce the use of inappropriate antipsychotic drug use, maintain and improve resident mobility, and reduce healthcare-acquired infections. You may find that you've already implemented some or many of these strategies, but hopefully you will also find some that you haven't thought of or that will make you think of other interventions to try. And now I will turn it over to Kathleen.
Hi, this is Kathleen Lavich. I'm a Quality Improvement Coordinator with MPRO in Michigan. I'd like to talk about expectations for our participating nursing homes. Generally, each team should be composed of interdisciplinary members. For example, a team should include people in a position to explore the problem, like direct caregivers, such as nursing assistants. If the problem being addressed involves, for example, dietary choices, then someone from the dietary department should also be on the team. Look at your quality measures and the change package and other data to choose your home's area of focus for your performance improvement project. Test and implement system changes at your nursing home and complete a short questionnaire every quarter. An example of a question that might be on the questionnaire is that we might ask you what performance improvement project you have chosen. We would like you to attend and participate in the learning sessions and other educational activities. This collaborative will be an all-teach, all-learn environment. And we want you to share your best practices, your success stories, and lessons learned. So where can you find information about the collaborative? You can go to the Lake Superior Quality Innovation Network website. This is the home page for that, and there's the link. And you can find information about the nursing home initiative, as well as all the other initiatives that the Lake Superior QIN is working on. If you click on initiatives, you can go to the nursing home page. And there's a link for the nursing home page also. On the nursing home page, it will say reducing health care acquired conditions in nursing homes. If you click on events, you can see upcoming webinars and other educational events. And you will also find upcoming events in the bi-monthly nursing home e-newsletter that we send out. To find upcoming recorded webinars or learning sessions or to view a past learning session, go to the Lake Superior QIN YouTube page found at this link. Next steps, again, I'd like you to form an interdisciplinary team. If you are new to QAPI or need a refresher, to use this link here, number 2, to view a foundational QAPI webinar done by Dr. Jane Peterson. There will be an open call on April 14th to answer your questions about QAPI and the QAPI self-assessment, and the information is there on the screen. You should also be receiving a flyer regarding this open call. Number 4, we're going to ask you to complete the CMS QAPI self-assessment by June 1st, 2015. Or if your nursing home has their own QAPI self-assessment, you may complete that by June 1st. There's a link here for the QAPI, the CMS QAPI self-assessment. And also, if you're not sure how to complete it, we have a recorded webinar that you can watch at this link. We also would like your home, your team, your nursing home team, to identify at least one area they will be focusing on. We would like your nursing home to review the National Nursing Home Quality Care Collaborative Change Package with your team by May 1st. And again, the link is here. And number 6, we would like you to complete the virtual learning session 1 bundle by the end of May. But as Christy mentioned, more information will be coming about that. The current upcoming events include the April 14th open call on QAPI. On April 16th, there will be a grade 8 webinar on surviving sepsis, early management safe lives. On May 14th, we will have a grade 8 webinar on root cause analysis. During the month of May, we will be doing learning session 1, as we said. And on July 9th, there will be another grade 8 webinar, and that one will be on mobility. So a lot of upcoming events, and as these things are coming up, we will be sending out flyers to all of our participating nursing homes. Now I'll give this back to Christy for her to finish up. Thank you.
Thanks, Christine. Okay, so, oops, I'm going backwards. Oh, all right. Now we're going to just take a little while to meet the team that you just heard. Just a few of us this afternoon, but our teams are quite a bit bigger than that. The Lake Superior Quality Innovation Network is actually one of 14 quality innovation networks that are working with healthcare organizations all over the country to improve patient safety and reduce harm and improve clinical care. So, partnering with other states is really new to the QIO program, and we're really excited that we have the opportunity to work with our 3 states together. So that's one thing that's really changed about the QIO program, and a few other things have also changed for the nursing home work. Some new things that we haven't done before and that we think are really going to be helpful when it comes to improving nursing homes in our states. And one is that we're going to be spending time that we've never really done this before, and it seems like one of those aha moments, like, why didn't we? But we haven't really engaged residents and families very much in our work. We're doing all these things for them, but we really haven't really brought them into the process. So we're trying to, we've been asked, and we're up for the challenge, and we're excited about it, that we're going to be sharing getting some residents and families involved to share their stories and also help them to advise the planning work that we're doing. So we make sure that what we're bringing forward in this collaborative is something that's actually important to families and residents, that it means something, and that we can even offer them something that they can also participate and learn from, so they can actually become more part of your quality improvement team. So when you think about putting together a quality improvement team, you probably don't think automatically of residents and families, but we do need to find ways to get them more engaged in our work, and so we're going to be really working hard on that. We also are utilizing peer coaches and advisors from high-performing nursing homes this time around, and for the LSQIN, we have already have 15 peer coaches and advisors that have already done some advising for our work, and they're a great group. They came from some high-performing homes. They're an enthusiastic bunch, and we're really excited that they're going to be helping us in our work. Again, they'll be sharing some stories of ways that they've had success in their homes, and as I mentioned before, they'll also be advising us as we plan our work. So, for example, we've already brought them into some of the planning conversations around our first learning session, because that first virtual learning session is something new that we've never done before, and we wanted to make sure it was something that made sense for you all in your homes, if that's something that was workable. So we have been getting some help from the coaches and advisors, and we look forward to continuing to do that. The other thing that we'll be doing this time around that is a little bit different than those that maybe participated with us in the past is we're going to make a real concerted effort to coordinate our work with other settings of care. You know, healthcare tends to be very siloed and very into, this is all around nursing homes, this is all around hospitals, this is all around clinics or home health. But instead, we really want to start reaching, really thinking about how do we affect each other. And, you know, the biggest area, of course, was obvious is when you're talking about care coordination or care transitions, when we're transitioning from one, from the hospital to nursing home or home health, you know, to nursing home and back and forth, and how can we do a better job with coordinating the care. So what you will be finding is that some of the educational things that we'll be doing it won't be just for nursing homes. We'll be doing some work, for example, on healthcare-acquired infections. And a lot of that is the same work that's happening in hospitals, and we can learn from each other. So we'll be doing that kind of work. And as I mentioned before, all of the quality innovation networks in all the states are currently putting together communities. So communities across the continuum of care that are working together to work on care coordination. And we're going to try to tap into those communities too, and bring you into what's happening there. So this goes really beyond just the nursing home, but really across the continuum of care. So we're pretty excited about that work. As we've mentioned several times, but we just want to make sure you got it clear, we have 3 states that are partnering together, Michigan, and the name of that organization is MPRO, Minnesota is Stratus Health, and Wisconsin is MetaStar. So we know there's some confusion already out there because we have a new acronym we've added, the LSQIN, and you all are maybe used to working with these organizations on this slide, but we want to make it clear that we are the same, probably the same people you worked in the past. We just are under a little different umbrella called the LSQIN, but we're all kind of doing the same thing, and really we have the same goals and that kind of thing. So we want to introduce you to our team, and we thought it might be helpful if you saw some pictures, because you'll be hearing from us a lot, and you can kind of get an idea of who we are. This is the Michigan team you're looking at, and this next one, this is our Minnesota team, and here is the Wisconsin team. So this is who you'll be hearing from for the next couple of years. All right, so on this slide is the contact information for each state. So if you have any questions about, after this webinar, if you have any questions about the National Nursing Home Quality Care Collaborative, you should direct it to the whoever we have, depending on what state you're from, the contacts on this particular slide. You'll also notice at the bottom of the slide it says for information on how to join the NNHQCC, go to, and there's a link. And we're reading over here in the chat that maybe these links aren't working from here, so we apologize for that. We'll send out the links afterwards so you all can link to everything we talked about here. But we know that some of you might be on this call that haven't joined yet. Probably most of you have. But if you haven't joined yet, if you use this link on this slide, it will take you to a page that gives you instructions on how to join the collaborative. And it's a little bit different for each state. It's a different link. This will take you to, actually, and it'll take you to our website too. So I think we're good. So we now have time for questions. So operator, can you remind our participants how to get in queue for questions?
Certainly, the floor is now open for your questions. If you have a question or comment, please press 7 on your telephone keypad.
We're just looking in chat too. Let's see. Okay, so here's a question that says, will the data/graphs be able to compare like facilities, i.e. short-term rehab facilities, as opposed to long-term care skilled nursing facilities? Great question. The answer at this point is no. So we really won't be getting that into that detail. You won't be able to compare against like facilities at this time, but we'll keep that in mind. Any other questions?
At this time, there are no questions, but as a reminder for a question or comment, please press 7 on your telephone keypad. There's a question from Amy. Amy, the floor is yours.
Hi, Amy.
Hi. I was just wondering, how can we make the slides available to us today for if we want to go over these again?
Sure. If you weren't able to access the slides before the webinar, if you would please send, and it's in chat somewhere, but if you would please send an email to Barb Olson, she'll send them to you. So let me give her her email address. It's BOLSON, so it's B Olson at Stratis, STRATIS, health, HEALTH.org. And we'll send them to you.
Next question comes from Gail. Gail, the floor is yours.
Hi, Gail.
Hi, could you please review the assignment for the next quarter one more time?
Sure, I'm going to just find that slide. And you know what? We'll be sending an email out with all of this too, so never fear. You'll be hearing more information. So, Kathleen, did you just want me to go over it again? Okay, so I brought up this slide. So what we're asking you all to do is first make sure, probably many of you already do this. You might already have an interdisciplinary team that works on quality, but if you don't, we want to make sure that you bring that together, and maybe that's who you have in your room right now. Hopefully some of you have your teams together. So if you haven't done that, please do that. We realize again that all the homes are in a different place. And sometimes some of you might feel a little overwhelmed right now because you want to get caught up on what's QAPI and all that kind of thing. So this is not required, but if you want to, there is this QAPI short webinar that you can watch that we have in here. And again, we're going to send these out to you because apparently some of these links are not working. You can also, on next week, on April 14th, and we'll send out a flyer about this, there's going to be an open call. So if you want to call in and talk with an expert on QAPI, Dr. Jane Peterson is going to be on for an hour, and you can ask any question you want about QAPI or about the QAPI self-assessment. Again, that's not required, but if it's something that you want to do, you can do that. The QAPI self-assessment, we're asking all homes do that or something similar, if they have something similar in their organization, by June 1st. And if you've done it really recently, at least review it and have by June 1st, have it. And we mentioned we're going to send you out a short questionnaire, and one of the things we'll ask in that questionnaire is, have you had a chance to do the QAPI self-assessment, your team? And we're going to ask you when you did that, what date you did. And we'll also ask you what's like one thing that you noticed when you did your QAPI self-assessment. What's something that really stood out that you need to work on? Okay? And there is a nice little short webinar that Dr. Peterson did on how to complete the QAPI self-assessment, which we've included the link here, but again, we'll send it out because I understand you're not finding these. And then finally, Liz talked a lot about the change package. That change package is going to be really the foundation of everything we do together. So we're going to be referring to that a lot, and we want to make sure that you're familiar with it, you know where it is, and it's kind of at your fingertips, and your team has kind of looked at it. So we would ask that before we send you the learning session materials in May, that you have at least had a chance to look at that change package. And then the last thing is we talked about the first learning session, and so we will hope that by the end of May, your team will have a chance to look at those short webinars, and we'll be sending those out in the beginning of May. Did that answer your question?
Yes.
Okay. Any other questions?
Christy, Kim's got a question in chat about when they can anticipate getting their composite scores.
Great question. Okay, so I was just talking with the analysts on this. The hope was that they would go out by the end of this month, and they might very well go out by the end of this month. It kind of depends when we're waiting for CMS to send us the most recent data. Last month it came out on the 22nd of the month. If it comes out on the 22nd of this month, it takes like 5 to 10 days to put it all together for the analysts to make these reports, because it's a lot of 480 reports right now. So, but if it's not by the end of April, it'll be right near the beginning of May. Good question. Any other questions?
There are no further questions, but as a reminder, for a question or comment, please press 7.
Liz or Kathleen, is there anything else you wanted to say?
No, I think you covered everything, Christy.
Okay.
Yep, sounds good.
Okay, well, I want to just let everybody know that after this is over, like within the next day or so, you will receive a short evaluation form via email. And we would appreciate it if you take a minute to provide feedback on today's session. Once you've completed the evaluation, you're also going to receive a certificate of completion. But I also want to remind you that this session was recorded and will be available at www.lsqin.org in about 2 weeks. And again, when it's ready, we'll let you know. So if somebody else from your team, if you want to listen to it again, or you want to review it, or if somebody else from your team you think should listen to it, it will be available. So no more questions, Wes?
At this time, there are no further questions.
Okay, then I think we'll go ahead and end the webinar. Thank you all very much for participating. You have a great afternoon, and I just want to let you know, I can speak for the whole LSQIN and letting you know that we're really thrilled that you've all taken charge and that you're going to be working with us in the National Nursing Quality Care Collaborative. I know we're going to learn from each other, and you know what? We're going to learn a lot from you all. We know that because we know in the past we just learned so much just from the homes that we work with that we can pass on to others. So, sounds great, and you all have a great afternoon.
Thank you. This concludes today's teleconference. We appreciate your participation. You may now disconnect your line at this time.